Today we'll be talking about last health program, which is National Polio Eradication Program. We are already done with polio since 2011. We have not seen any case of polio in our country. But still we are running a part of this program, that is pulse polio. So we will be talking about polio in this session. So, polio is a viral disease and it mainly affects nerve cells, that is of the spinal cord, and which lead to paralysis or muscle weakening of some part of the body. So, this was launched in 1995 after World Health Assembly passed a resolution in 1988. And this resolution was towards a global initiative of polio eradication. So under this program, children who are in the age group of 0 to 5 were administered polio drops during national and sub-national immunization rounds, especially in the high-risk areas every year. So about 172 million children has been immunized during each national immunization day. Now, what are the objectives of National Polio Eradication Program? To achieve 100% coverage under oral polio vaccine, to immunize children through improved social mobilization, plan mop-up operations in area where polio virus has almost disappeared, maintained high level of morale among the public to immunize those children who are not earlier immunized or partially immunized, to boost the immunity of the children already immunized, to replace disease carrying wild virus by harmless vaccine viruses in the environment. So basically the objective is that we are having a universal immunization program. So as per that schedule, uh, every children are given uh, doses against vaccine preventable diseases. So one of the vaccine preventable diseases is polio. So just after birth, 0 dose of polio, then first dose, then second dose, then third dose of polio vaccine is being administered under universal immunization program, or nowadays people call it as Mission Indradhanush. So this is one way. Now suppose a children missed those doses or never got those doses. So those people are not immunized against polio virus. So to cover up those children, Government of India uh, organizes Pulse Polio program to ensure that those children who had not been covered or partially covered under universal immunization program should be administered doses of pulse polio, or those who has been already fully immunized, so their immunity will be boosted through pulse polio. So as I said, pulse polio last case was seen in India in 2011. Exact date was 13th of January, and this case was reported from Havra district of West Bengal. Basically, there are three types of polio virus. So the last polio case, which was reported from West Bengal, was of type 1 polio virus, and WHO on 24th February. So before that, just to know. And before announcing any country or no, eradication of any program, WHO wait for next 3 years, so that now for consecutive 3 years, if there are no cases being reported, then the country is declared as polio free. So last case was detected or reported on 13th January 2011. So on 27th March 2014, WHO declared India as a polio-free country, since there were no mild polio cases reported, in or for 5 years. In on 24th February 2012, WHO removed India from the list of countries with active endemic wild polio virus transmission. So just after 1 year of reporting of last case, we were removed from the list of the countries where active cases were reported. And then in 2014, we were declared as polio-free case, polio-free country. And type 2 virus was last reported in India in 1999. So how this transmission of polio virus happens? So WHO defines polio or poliomyelitis as a highly infectious viral disease which mainly affects young children. So viral is transmitted from person to person, which spreads mainly through fecal-oral route or less frequently by a common vehicle, that is contaminated food or water. And then it multiplies in the intestine, from where it can invade our nervous system and can cause paralysis. So open air defecation was one of the major causes of spread of wild polio virus in our country. So people were defecating in the open, and then somehow they were passing through a drain, and then the supply water pipes were coming out, and if they were leaking somewhere, then those drain water were contaminating the water, and that's how this disease was spreading through fecal-oral route. So under this National Polio Eradication Program, all states and union territories have developed a rapid response team, which was known as RRT, to respond to any polio outbreak in the country. To prevent the virus from coming to India, the government has since 2000 March made the OPV, that is oral polio vaccination, mandatory for those who are traveling between India and polio affected countries. So still there are few polio affected countries, which are Afghanistan, Nigeria, Pakistan, Kenya, Syria and Cameroon. So if anyone is traveling from those countries to India, they are supposed to be vaccinated, for polio by oral polio vaccination. So until or unless they are not vaccinated and they do not produce that vaccination certificate, they are not allowed to enter Indian border. So World Polio Day. World Polio Day has been established by Rotary International. If you will see, still Rotary International is investing a lot, especially during pulse polio campaign throughout India. So 24th October is celebrated as World Polio Day, and this was the birthday of Jonas Salk, who developed. If you will read in detail, there are two vaccines, Salk and Sabin. So these are the vaccines which are used against polio viruses. So Jonas Salk is one of the scientists who developed Salk vaccine against poliomyelitis, and establishment of global polio eradication initiative started in 1988 to reduce worldwide polio by 99%. So since 1988, we had been celebrating World Polio Day, which is celebrated on the birthday of Jonas Salk. So as I already mentioned, there are three viruses which are responsible for poliomyelitis. These are wild polio virus type 1, wild polio virus type 2, and wild polio virus type 3. Now, these viruses cause irreversible paralysis or even death, and there are two types of vaccines to prevent these infections. One is oral polio vaccine, which is given at in 3 doses, 6 weeks, 10 weeks, and 14 weeks, and a booster dose is given at 16 and 24 weeks. And the second is inactivated polio vaccine, which is given as an additional dose along with third dose of DPT under universal immunization program. Now, if you will see the life cycle of polio virus. So as I already mentioned, through orophycal route, it enters in our body, and this virus settles, infects, and replicates in the cells of the intestine. From there, it can enter into the bloodstream, and then it uh, affects spinal cord, that is central nervous system, and destroys cells in the spinal cord, leading to paralysis, affecting the nerve cells. So that's how this viruses enters in our body, settles in intestine, multiplies over there, and from there it travels to our bloodstream, from where it affects the cells of the nervous system, central nervous system, that is spinal cord, and lead to paralysis. So polio is caused by polio virus, which belongs to uh, picornavirus family, and rhinoviruses belongs to enteroviruses subgroup, which consists at least 70 types of viruses which resides in the intestine, and that incubation period is of 3 days, and period of communicability is 10 days. And these viruses grow, and their favorable climate is, something which is very moist in nature, so they grow and prosper in rainy. Anyone trying to say something?
Sorry, sir. I was a little late in joining the class. I
Okay,
had a family listening.
okay, no worries. So the symptoms, there are two types of cases: non-paralytic and paralytic. As I said, that it can cause paralysis, or it can lead to uh, there is something called paresis, that is muscle weakening. So the non-paralytic symptoms are fever, sore throat, headache, arm and leg pain, muscle tenderness, and vomiting. And the paralytic cases, they show a symptom of loss of reflexes. So there are multiple reflexes, deep knee tendon reflex, or plantar reflex, ankle jerk. There are multiple reflexes which a doctor checks. So these some of these reflexes are lost in the paralytic cases. Now there is severe spasm. Now there are two types of paralysis. One is flaccid, and one is spastic. Spastic is where there is increased muscle tone in the body, whereas flaccid cases are that cases where there is loss of muscle tone, atonia, which is known as in medical terms. So these cases will show severe spasm, no muscle pain, high grade fever, much of the weakness, and then sudden paralysis are observed in these cases. So how these cases are polioviruses are tested. So all cases of acute flaccid paralysis, flaccid again I am telling you where there is no muscle tone or decreased muscle tone. So these cases among children under 15 years of age are supposed to be reported, and tested for wild polioviruses through stool examination within 48 hours of those onset. So if any case who is have which is supposed to have acute flaccid paralysis, so stools of those cases were supposed to be reported and tested under 48 hours for poliomyelitis virus. So there were multiple surveillances no, which were being done to take care of these cases. So, national-wide acute flaccid paralysis surveillance was the gold standard for detecting cases of poliomyelitis. So, there were 4 steps of these surveillances: finding and reporting children with acute flaccid paralysis, as I said, transporting stool samples for analysis, and there's isolating, identifying polioviruses in the laboratory by stool examination, and mapping the virus to determine the origin of the virus strain. So first, these acute flaccid paralysis cases were reported either through government doctors or private doctors, that stools were supposed to be transported within 48 hours to higher centers for stool examination, and then these polio viruses were identified in the laboratory, and then they used to map that if there is a polio virus identified in the stool, they were of which category? Wild virus, polio virus 1, 2, or 3. So then the second is environmental surveillance. Environmental surveillance involves testing sewage or other environmental samples for the presence of polio viruses. As I said, that the fecal-oral route was one of the mode of the transmission, and then open defecation was the major chunk responsible for transmission of wild polio virus. Not even in India, wherever it is still present, that is one of the prominent causes. So environmental surveillance was very mandatory, and then they used to test for the presence of polio viruses in the sewage water. Environmental surveillance often confirms wild polio virus infections in the absence of cases of paralysis. So even if there were no cases, if wild polio viruses were found in the sewage water, so they were that area is still susceptible to come out with a outbreak of polio viruses. So systematic environmental sampling provides important supplementary surveillance data. So basically in this systematic surveillance sampling, so although data from multiple sources, slums were taken, I mean samples were taken and were tested. So that was one of the routine things which has been followed to ensure elimination or eradication of polio virus from India. So the outcome of this national polio eradication programs was that Indian effort to polio eradication has been identified at a larger global level, and this is one of the case studies which still people are studying how efficiently India successfully eradicated this program. And then a strong vaccination and surveillance program was where some of the key factors which led to eradication of this program. So clean, safe drinking water and good sanitation were the key for fighting a spread of polio and making polio eradication program successful. So not only surveillance, vaccination, but apart from that, importance of improved sanitation and hygiene condition were also identified under this program. So this was all about polio eradication program, which we were supposed to learn uh, under this health program. As I said, this is the last health program which is supposed to be read as per your syllabus. And then since we are no, WHO has already announced India as a polio-free country in 2014, but we are still continuing pulse polio program under which uh, those children who had been already fully immunized, partially immunized, or not immunized are being given pulse polio drops throughout the country in a phased manner to ensure that we should provide immunization against wild polio virus to our coming generation. So this was all about pulse polio program. Any questions? Okay. So I assume there are no questions. I will be sharing the slides with Seema. Last class slides are still with me. So the two classes slides, that is TB and polio, I will be sharing with Seema, and she will be sharing with us. Thank you. If you guys have any question, please reach out to me whenever you feel